Okay, so kicking off, we have the next session now is with Emily Fardoulys. Apologies, Emily, if I've mispronounced your name. I'm sorry, but I'm
very good. Very good.
Oh,
well done.
Awesome. Thank you very much. So the session is called Enabling for Smooth Transitions by Creating a Change Communication Framework. This is really a topic I'm really interested in, so I'm very much looking forward to it. So Emily Fardoulys is the National Communications Manager for Ramsay Healthcare here in Australia. It's the nation's largest private hospital operator. Now, Ramsay employs 32,000 people and operates more than 70 facilities and 59 community pharmacies across the country. So Emily is responsible for leading and planning the execution of the organisation's internal and external communication strategies. She understands the importance of relationship building and has a strong belief in the company's philosophy of people caring for people. So prior to joining Ramsay Healthcare in 2016, Emily was a television news reporter and producer, working with the 7 Network, 9 Network and Prime Television since 2007. So coming from a journalism background, Emily thrives in a fast-paced and collaborative environment and has a keen interest in news media and storytelling. Emily also holds a Bachelor of Business and a Bachelor of Journalism from Queensland University of Technology. So I'd like to welcome Emily. Thank you.
Thanks very much, Zora. I think I've had my fair share of the fast-paced environment quota in the past year, as I'm sure all of you have as well. I'm just going to start by sharing my screen. So as Zora mentioned, today I'm going to be looking at the topic enabling transitions by creating a change communication framework. So I'll be looking at to offer some tips based on my experiences of assessing a situation and creating a response plan to address potential scenarios and risks, assessing the internal and external stakeholders of your organisation and identifying how each of those groups will be impacted by potential change, and also how to collaborate and engage your stakeholders to create a strong brand presence. Sorry about that. And I have to say, it is a little bit weird that I can't see everyone today. So I guess I'll just have to pretend like you're laughing at all my hilarious jokes and not nodding off. So let's press on here. So just by way of background, I thought I'd give you a little bit of information about Ramsay. So we're one of the largest private healthcare companies in the world with operations in more than 500 locations across 11 countries. In Australia, we're the largest private hospital operator, as Zora mentioned, and also the 4th largest private employer. We have more than 70 facilities, day surgeries and mental health clinics, and we have actually 60 community franchise pharmacies now. We've added one more since I sent through that information earlier, as well as 40 in-house pharmacy dispensaries. We admit more than 1 million patients every year. We deliver more than 23,000 babies per year. For some reason, everyone likes to hear about our baby stats. And we also employ more than 30,000 people. We also have a decentralised management structure, which actually gives our hospital executive teams and managers the autonomy they need to develop really productive relationships with our doctors, who are actually our partners rather than our employees. But while we have a decentralised management structure, when COVID broke out last year, it was obvious we needed a centralised communications structure to tackle this particular issue. So today I really want to focus on 2 case studies from last year to highlight how we approached 2 instances of incredible change for our organisation and how we brought our stakeholders along the journey with us. And David in the previous session was really spot on when he said that we really need to put the stakeholders' needs at the centre of everything that we do. So the first case study I want to run through today involves some key moments from March 2020, which was the onset of the pandemic, obviously, when COVID really began impacting us in Australia. Obviously, this has continued throughout 2020 and into 2021 for probably all of us. However, I just wanted to focus on this particular month where we had a real emphasis on control and on caring for our employees and building resilience. And then the second case study I want to look at involves how we communicated a change of CEO and a change of organisational structure in the midst of the pandemic, and how we used it as an opportunity to reinforce our values with our stakeholders, as well as to enhance our brand awareness and our reputation. So I think it's probably safe to say that everybody here has experienced a lot of change in their respective industries and roles over the past year. But I think it's also fair to say the pandemic has affected us in all slightly different ways. So I just wanted to firstly run you through a timeline overview of March 2020 as we saw it at Ramsay, because I think it's important to give some context before I go into the comms aspects for those of you who aren't in the healthcare sector. So starting in the bottom left-hand corner on the left side of the slide, we began response planning in late February, and then in early March established 2 COVID response teams. One of those had representation from departments and sites across the business, and one with executive leaders. So then in early March, we had our first task force meeting, and we embarked on a really rapid phase actually of mobilising our operations and then communicating the changes taking place on a daily basis. And I'll go into that aspect shortly in more detail. So then moving along the timeline, on the 5th of March, restrictions began to change for our employees, our visitors and our patients. And this is something we'd never had to do before. So anyone who'd been to an at-risk country where there was a high risk of contracting COVID-19 couldn't come into our facilities. And as you can imagine, this had a lot of flow-on effects for staff who couldn't come to work, patients who needed to postpone their surgeries, and people who couldn't visit their loved ones in hospital. And I'm sure Zora had a lot of experience with that aspect during the second wave in Victoria. These restrictions continued to change regularly throughout 2020 and into 21. Still to this day, we're updating and communicating changes based on the latest advice that we receive from the state and federal governments. Then on the 9th of March, we began to ban staff travel, which started with international travel, and then later in the month, domestic travel. And then, of course, March 11, the World Health Organization officially declared that the spread of COVID had now turned into a global pandemic. So soon after that, we communicated our new and enhanced and more robust guidelines, which our clinical quality teams had developed to increase things like cleaning, infection prevention control protocols, such as wearing PPE, etc. Then as case numbers of COVID increased in Australia towards the end of March, the federal government announced that non-urgent elective surgeries were to be temporarily paused to free up beds and resources preemptively to battle COVID-19. So then it enlisted the support of the private hospital sector, which includes us at Ramsay, to make sure that Australia had the maximum capacity to really fight this virus. So this meant we temporarily integrated into the public hospital system effectively, making our resources available to the system when and if required. And this was done in exchange for the government offering agreements to private hospital operators such as us to ensure our ongoing viability. And over the coming months, we entered into partnerships with the various state governments. At the end of March, though, came one of our first big tests during the pandemic. So on the 30th of March, one of our hospitals in WA called Joondalup Health Campus was called on to accept 30 COVID positive patients from a cruise ship off WA. So this is a photo of one of the lovely cruise ship passengers, pictured here obviously in much happier times. He's a German man who was actually one of our sickest COVID patients at the time. And he's pictured here leaving hospital after a 2-month stay, which was, it was quite a miraculous recovery. It included 2 weeks in the ICU and 6 weeks on the COVID ward and rehab ward of that hospital. So when Joondalup Health Campus accepted him and the 29 other passengers in March last year, the hospital's COVID clinic had only been operational for 5 days. It had taken already 2 days to construct. And even though it had only been operational for 5 days, it had already had 3 COVID patients through. So this arrival of the 30 additional passengers from the cruise ship meant the hospital had a total of 33 COVID patients, which is thought to have been the single biggest cohort in any Australian hospital at that particular time. So as well as the obvious challenges relating to the pandemic, most of the cruise ship passengers were aged over 70 and very few spoke English. So there was a huge response from the hospital to make sure that these passengers could be cared for, to make sure staff were trained on the correct use of PPE, to make sure cleaning requirements were increased. I think they were actually more than doubled at the hospital, and they designated a specific COVID intensive care unit. Quite remarkably, actually, the staff also managed to care for these COVID patients without any further transmission. So this change and really all the other changes which occurred in this timeline in March, in the space of just 1 month, had huge ramifications for all of our stakeholder groups. So, you know, the more than 31,000 staff, 16,000 doctors, many thousands of patients and visitors and suppliers and other contractors. So like most businesses, the start of the pandemic in particular was an enormous time of unprecedented, I hate that word, I don't know why I'm using it, unprecedented time of change. We needed a structured and effective approach to our response and to communicating our response. So as I mentioned, we created 2 COVID response teams, which I've put there in the middle of that diagram. So one with representation from the departments and sites across the business, and one with the exec leaders. So it was really important that we included people from different streams of the business. So I'm talking HR, procurement, finance, operations, the legal department, etc. And both of the teams had the same focus on 4 major aspects, being PPE, organisational readiness, workforce matters, as well as building and maintaining resilience. And I feel like that last part is really important for comms. So in order to assess the situation and to plan accordingly, we developed a risk matrix. We mapped out the various potential scenarios in regards to staffing, to supply, which was a really critical point at that moment, our capacity, our critical service providers, and also government requirements, of course. So we made the decision early on, and David touched on this as well in his presentation, that all our COVID-related comms must come from the COVID response team to ensure there was one source of truth. So we really wanted to prevent any accidental misinformation that might occur. So that was really important. So from the outset, we wanted to be able to control that messaging and communicate it to our stakeholders in a really timely way. We wanted to protect our employees and create purpose or boost morale wherever we could. We wanted to be really proactive about the way we communicated, and always to make sure that we were transparent, especially with our internals comms and speaking to our staff who were really on the front line. So we gathered the relevant facts and we shared this information at our regular task force meetings. We identified our stakeholders and defined the tasks and issues at hand in line with our crisis comms plan, which we'd already had established well before this particular crisis. We assigned responsibilities and we developed a stakeholder specific plan, and that's really important to make it specific for your stakeholders, for both internal and external audiences. And then we disseminated that through a variety of different communication methods and channels. So the really important part of this is that we really focused on crafting each message with each individual stakeholder in mind, putting ourselves in their shoes, you know, asking what do they care about? What are they worried about at this point in time? What kind of information can we provide them that will either help them to do their job better if they're a staff member or a doctor, or improve their life in some way if they're a patient or a loved one of a patient who wants to come to visit them in hospital. So we also maintained ongoing monitoring of a range of external and internal factors, you know, everything from media coverage to feedback that you might get from a staff member off the back of an email. And then we adjusted that plan as necessary. So we use a wide variety of communication methods, as I know from the past couple of days that most of you do as well. So We do this to try to reach our stakeholder groups because they're so diverse and spread out across the country. And I just break these down into the 4 categories of digital, such as social media, websites, emails, printed, such as posters, flyers, brochures, and corporate publications, face-to-face. We haven't had as many of these avenues, unfortunately, during COVID. However, we pivoted to convert a lot of these methods into virtual interactions. And finally, the last one, media, and we target both mainstream outlets as well as industry publications. Because our stakeholder groups are so varied, we do use all of these communication channels in our plan. We rely on some more than others, but for example, a large proportion of our employees aren't online. So these are mainly our nurses. And when I say they're not online, I mean they don't have work email addresses or use a computer in their jobs because their roles are so customer facing, looking after our patients on the front line. So we really need to cast a wide net in order to be able to connect with them. Just while I'm on the topic of communication methods, Emily, I might just bring in that poll that I'd like to do at this point. I think she's going to bring it up on screen for you. And I just really wanted to talk to you about how you think about, to get you to think about how you communicate with your stakeholders. And as a result of COVID-19, whether you've made any long-term changes to your comms methods or platforms. I thought it might be interesting for us to just see each other's answers as a group.
Emily, would you like them to end it? It's ended now.
Oh yeah, that'd be great. We could probably go through the results a bit later if you want some time to put together the results.
Would you like me to share them with you?
Yeah, that'd be great. Thank you.
So 20% answered yes, significant long-term changes. 68% said yes, some long-term changes. 8% we made short-term changes only, and 4% no changes at all.
That's really interesting, isn't it? So I guess it highlights, you know, the way we've all had to pivot and then how our organisations have really embraced this change and in a lot of cases then, you know, adjusted the future direction. So it's interesting. Thanks, everyone. I just wanted to also give you a small snapshot of what it looked like in 2020 in terms of comms. So caring for COVID patients and managing the communications around this, communicating regular changes to hospital visitor restrictions, developing and communicating our own QR code smartphone app to screen 100,000 people per week in our facilities across the country. We administered 400% more flu vaccines than the previous year through our pharmacy business across the country. And we continued to support local construction jobs with 11 major development projects continuing at our hospitals. And we also facilitated 500 telehealth meetings per month and communicated these to our stakeholders. So for example, we pivoted to offer our maternity patients virtual childbirth classes. You know, normally they'd come into hospital to have those classes in the lead up to their birth, but because visitor restrictions meant they couldn't access these sessions face to face, we offered this alternative instead. And to spread the word about that, we organised some media opportunities with TV and newspaper outlets so that women in the community could see our staff were still here to support them during their pregnancy. So when it comes to collaborating and engaging your stakeholders, my experience has been that really the best way to do this is to find out what information is important to them and also how they prefer to receive it. And it's different for every group. So we all know that with the fast-paced nature in today's world, we need to be able to meet our stakeholders where and when they want to be met. So along this line of thought, last year we carried out a pulse check of our staff to confirm that we were on the right track during the pandemic with our comms. And it was really great feedback. What they told us is that they wanted regular and transparent communication and appreciated having information from one source. They wanted us to keep acknowledging the work of employees, which I think is really important, that recognition aspect. And only communicate when there was something important to share. And I think that one is actually also a really important one to keep in mind. Don't communicate things just because another executive leader perhaps in the business has asked you to throw this into your next comms, really think about whether it's relevant to people, because the last thing you want is for people to stop reading the comms you're putting out because they think that not everything in there is relevant to them. We also received a lot of positive feedback about how our regular comms during COVID was helping staff to feel included, informed and connected, providing reassurance and allaying their fears during an uncertain time, inspiring trust, and perhaps most importantly, actually significantly reducing their anxiety levels. And this was all really important feedback to make sure we were doing everything we could to support the mental health and wellbeing of our people during COVID. So as a result of what we did during COVID, we've actually instigated a regular weekly CEO communication from our Australian CEO to all of our staff members, which didn't exist prior to the pandemic. And we monitor the analytics of that each month. And so far we've maintained some excellent open rates. So we know our audience continues to be engaged. So having that, that regular national staff communication avenue really set us up well for the next major comms piece that we're about to undertake, which is our second case study that we'll just go over to now. So in September last year, while we were still in the midst of the pandemic, and particularly in Victoria, where we've got about 15 hospitals, and we were undergoing the second wave there, which was affecting all of those sites and clinics and pharmacies as well in that state. We then began to plan our comms strategy around an upcoming change of CEO in Australia, and following that, a revision of our strategic priorities and our organisational structure for our Australian business. So we followed some stepped processes towards announcing these changes, building upon the comms lessons that we learned during COVID. So these changes took place in two parts. So starting with the leadership announcement first, followed by the organisational structure announcement a month later. But I've included them here in both on the same slide because we applied the same steps to both parts. So first of all, gathering the facts. So this is the who, what, why, when, where, how. Then we identified all the stakeholders and the communication methods, and there were a lot of stakeholders internally and externally that we needed to really bring on that journey with us. So we needed to do things like mapping out internal meetings, arranging video messages from both the incoming and outgoing CEOs, planning social media posts, letters to industry and government stakeholders, emails to doctors and staff, etc., etc., etc. So we then developed stakeholder specific, again, really important to be specific, key messaging for both of these announcements. And this really does need to be varied, as I mentioned earlier, as the information you're communicating to, for example, the Federal Health Minister is going to be very different to the information that you communicate to hospital managers, for example, who are already aware, about the internal workings of the business. Of course, there's almost always going to be queries or feedback provided during times of change like this. So the next step is also about adjusting the plan to incorporate any important feedback that you might receive from your stakeholders during that time. And then you want to broadly communicate those changes by executing the comms plan. And again, we relied on our usual communication methods to distribute this information. And we did that in line with the channels that we know each of our stakeholders prefer. Now, a really important part of this process, I think, to take note of is the fact that it was underpinned by a focus on highlighting the new CEO's priorities for the business. And we also used it as an opportunity to reinforce the way to reinforce the company's values and purpose. So we call our values the Ramsay way for obvious reasons, and they are really absolutely central to the functioning of our business. We actually have a session coming up next week with our executive leaders where we're specifically focusing on the values. So it's a really important priority area for our new CEO. This aspect was particularly important for the internal comms piece, so engaging our frontline workers in our mission and beliefs, and enabling them to see and to be part of the bigger picture. So especially after a year where it felt like, all we did was talk about COVID. So we use this opportunity as a reminder for our reason for being, to really ground us all, and a chance to talk about our future priorities and our direction beyond COVID, because there has to be a future beyond COVID. So we also focused on enhancing our external stakeholders' awareness of our brand, and building on our reputation as a quality healthcare provider and a responsible, sustainable business. I also actually find, and I don't know whether you have this as well in your teams, but having a central messaging library is really useful in scenarios like this, because it allows you to draw upon information to help build out your comms strategy. So rather than trying to invent the wheel every time you put together a piece like this, and for us, this is a living document that we constantly are updating all the time. So I just wanted to sum up by providing some learnings and going through what we learned during COVID, and also how we're placed looking to the future. So for us, the pandemic really highlighted the appetite for internal comms, and the comms team was involved in leading many important changes. And I really liked the quotes from the two Nicoles we heard from yesterday from Telstra and AGL, who said that internal comms was the new black. I love that. And that internal comms was the bridesmaid becoming the bride. I think it's a really appropriate way to refer to the change that we've seen in this space over the past year. During a time that's been really, calamitous, really, for so many people, there's perhaps been a silver lining for communications professionals, giving us more of a seat at the table, and also more involvement in the business. The second point is about that as a result of more frequent and regular communications, we made a lot of great progress in closing the communication gap, but there are always more areas to improve on, and we're constantly looking for new ways that we can do that to help improve the experience of our stakeholders. Thirdly, the COVID-19 response team formation demonstrated the importance of having productive working relationships between the comms team and other streams in the business. And I really experienced this firsthand personally. So it's absolutely essential to have this widespread input to ensure that we're really planning for all scenarios, and we have input from various aspects of the business to meet the needs of all our stakeholders. The past year has shown the benefits of having one single source of truth, which I spoke about earlier, and a centralised communication structure. And this continues to be an important part of our strategy. We're still dealing with COVID, but also beyond that, we've learned a lot of lessons. So, as recently as this past week, we've communicated extensive information about the rollout of the COVID-19 vaccination program, and then how it will be rolled out to all our Ramsay doctors and staff. So this information is developed centrally, obviously based off the communications and the guidelines that come out from the government, but we do it centrally so there's no confusion or disparity among our hospital executive teams or pharmacy managers or other managers in the business when it comes to the information that they provide to their staff. To the next point, we saw that implementing a communications plan to equip our teams with the resources, the information and the tools they needed to help them to respond rapidly, expertly, and above all, safely. So I think our clinical governance team to this date has created something like nearly 300 guidelines and resources and tools and other types of checklists relating to COVID-19, which are then being communicated out to our staff. And then finally, we continue to monitor and respond to the situation. So our efforts over the past year have put us in good stead to make sure that we are well prepared to manage future challenges associated with the pandemic. We're kind of, in our groove now a bit, as well as other instances of great change in the organisation. So I think I'd just like to take the opportunity to open up to any questions that you might have. And thank you all for listening so patiently to me. So
Thank you very much, Emily. We do have some questions, so I'll ask you those. The first one's from Marnie. She's asked, what format is your central messaging library?
So I use a platform called Airtable, and I basically call it a glorified spreadsheet. But it's really great because you can have a number of different people who you provide access to. You can have visibility over it, and you can update it in real time. So you have the ability to be able to make changes, and you can provide different people with different levels of access. So if you want some people to be able to read it only, they can just read it only if you're worried that they might tinker with it and you don't want them to.
Yes.
But I find it a really useful tool to use.
That's excellent. Thank you very much. Another question here from Anne-Marie. What have you found the most effective channel to communicate with frontline workers?
So the main one that we use is email. And I mentioned that because our frontline staff aren't on work email, we actually use their personal email addresses so that we do reach every team member. We also have an app that we've recently introduced, which has a number of functions, including the ability to check your rosters, et cetera, but that's a fairly new one. So I'm yet to sort of see the results of how effective that is. So I would say that email is probably the main channel that we use, and that's the use of personal email addresses has only come online since the start of COVID. Okay, so before that, it was really hard to communicate with them.
Thank you. There's actually a session later this afternoon with Alastair Marshall from Coles, and Alastair was involved in the paper I mentioned earlier on the research I did, and they did some really interesting work from an internal comms perspective using external comms to provide messages to their staff who, So
I did hear Alastair talking at another event in December. And about it through TV ads and etc.
That's right. And using breakfast television. Okay, there's another question here. Did you identify any successful channels to communicate with elderly patients? One of my stakeholder groups is our members who are aged 60 to 80 years old. Email seems to be preferred, though we've tried SMS recently about AGMs, registrations, reminders, etc.
What we've actually found is that the majority of our patients who are elderly actually have a support person who's usually a daughter or a son, but we found mostly it's a young female who helps them with the process of coming to hospital and relaying information to them. So we do have, as I mentioned, we have a decentralized management structure. So when it comes to operational issues, we'll find that a lot of our sites will communicate separately with their patients, but we have a centralized communication structure when it comes to overarching COVID messages. So it sort of varies on a case-by-case basis as to how patients might be informed. For example, when elective surgeries were being cancelled, we were encouraging people to get in touch with their doctors or to call our main switchboard, and then we would direct their inquiries from there. So it wasn't all over email or on the web. A lot of elderly people call in.
I also found that through COVID, one of the channels, particularly with people with a called background, were communicating via Viber. So they were using that as their social media platform. So it's about understanding where they're at, I think, in a lot of cases.
That's right. You've just got to find out what works for your stakeholders, don't you?
Yeah. I have a quick question for you. How do you rebuild trust in your leaders after a major internal crisis?
For the public or amongst your leaders?
Amongst your team, amongst your staff.
It's a really good question. I think transparency is just the key point here. You just can't be transparent enough, and admitting that if you're wrong, being able to admit it is really key, but then also addressing what you're going to do to fix it. So we had one particular instance during COVID where we had an issue where we weren't transparent with our staff, and it backfired. We weren't transparent with our external stakeholders either. And it took a lot of time, and it took a change in management to, to be able to rectify that and address it, to do a lot of communications, reassuring staff about the way processes had changed and what we were going to do to fix things going forward.
Excellent. Thank you for doing that. Now we've got 2 minutes left. Is there any final point that you'd like to make? Because this thing does shut you off, literally. Just
I've noticed that.
It's bizarre. It just goes bang. So anyway, it's fine. Is there any final point that you would like to close off on? Because I've got questions, but it'll take you longer to answer. Yeah. I've personally got questions.
I'm really happy to answer any questions as well after this session, if anyone wants to connect by email or enter anything into the discussion. The only thing I would do is echo really what a couple of other presenters have said about the rise of internal comms and just really how important that has become for organisations. So I think that a lot of us have really pivoted to focus more on that space. Looking at more about the employee experience. These are advocates for us who are already involved in our business, and for us, we've got 30,000 of them just waiting to be able to promote, to raise awareness of our business and to enhance our reputation. So I think it's really important to harness the power of internal communication.
Yeah, very good point. I definitely recommend taking a look at that State of the Sector report that's just come out. It's quite fascinating having a look at where the gaps really are, and we can do better, put it that way.
I think so. And I did read that, and I think it's really interesting, that part about can your employee tailor their communications experience. And I'd be interested to know if anyone has been able to do that as yet. It didn't look like there was much of a take up. With the rise of AI, I think that's a really interesting area to look at and keep an eye on.
Yeah, it can be done. Anyway, thank you very, very much, Emily. It was fascinating. You've had a huge year, like a lot of people in our profession. So hats off to you. Thank you.
Thanks, everyone. Thanks for your time.
So we're about to knock off and go to morning tea and or morning break, and we'll see you in half an hour just after that. So look forward to seeing you at the breakouts after this. Thank you.